We're building a new facility to really keep up with the times. So if you think about what we take care of, we take care of some very significant problems that require medical management above and beyond what an orthopedist can handle or do. So the UK Medical Center really offers that experience where the children can get the needs met. Intensive care units, other pediatric subspecialists. Whereas at Shriners, we bring our mission. We bring that kind of special Shriners touch, that kind of tender, loving care aspect to our practice. And so it's going to be a perfect marriage between two organizations. So some of the new features are, if you walk in on the third floor, our clinic area is larger. We can take care of more patients, and it's really attuned to that family. So the whole layout of the hospital or the clinic is really, really neat. I think the kids will really enjoy it, and so will the families. On the second floor, we're going to have a upgraded motion analysis center, which allows us to evaluate children and also do quite a bit of research to look at how we're doing. There's a PT area there as well. And then on the first floor, we have two state-of-the-art operating rooms for outpatient surgery. So this really is a really neat facility that we're building. So because we're going to do outpatient surgery, there's still a need on the inpatient side, and that's going to be handled by the University of Kentucky. So those bigger cases we do, spine fusions, some of the more complicated procedures we do, will now be done at a facility that has intensive care, that has all the other resources available for those kids. What we're doing is collaborating. So we take care of the same patients. There's quite a bit of overlap, but we both have strong points. So it's probably a better way to look at it is a win-win. So the patient wins as a result of the expertise on the side of University of Kentucky and really that special Shriners care on our side of the street. So I think all of us benefit as a consequence. One of the fears people have is now they're driving on the campus of the University of Kentucky. But we've collaborated with the university as far as parking. The distance between parking and our medical center is actually closer than it is right now. And I think although there may be some challenges, it really is an upgrade, and it's really going to benefit our patients and physicians. So the important dates. Number one, April 17th, we're opening at our new center. And that's when we'll be seeing our first patients and doing our first outpatient surgeries at our new medical center. And then the other date is when our big grand opening is, which is May 21st, and we invite everybody to come. I think it's going to be great. Shriners Hospital came to be in Lexington back in 1926. So the Shriners system was initiated in 1922 in Shreveport, Louisiana, as a response to really what the healthcare needs were at the time. And at the time, polio was a scourge across this country. So the Shriners saw the need and actually stepped up to the plate and opened this wonderful system. So what's changed since then? Well, medicine has changed. We've essentially cured polio. It's really not an issue in the United States, but other significant orthopedic issues have come to the front. For example, cerebral palsy, scoliosis. So the Shriners have always taken care of musculoskeletal problems in children. The mission of Shriners Hospital, there's a three-part mission. So the first is clinical care, the second is education, and the third is research. So the clinical care we've been discussing, we're able to provide for children above and beyond what really other medical centers can because of what the Shriners have done. But in addition to that, we're fortunate to have 3 different medical centers sending us their residents for pediatric orthopedic education. We also train anesthesiologists. We have other allied health care coming to our facility. So education is one of the keys. And then research. We're fortunate to have Corsair Charities help us with research, but we collaborate with the University of Kentucky as well. So you can imagine a tricycle, and those are 3 parts of the tricycle, and if any one of the wheels fall off, the whole thing tips over. So it's really important to have that 3 parts of our care.